Welcome to In Defense of the Revolution, a Cuba Solidarity podcast. My name is Robert Crooks. I'm here with Cam Scott. Unfortunately, Samantha is not here with us today, but we will soldier on nonetheless. So we're recording this a couple days after the announcement from the U.S. government that there's going to be more visa restrictions having to do with Cuba's international medical brigades. And this is going to have a wide-ranging effect, I think, not just on healthcare in the countries that Cuba serves, but I think for healthcare across the planet, really. So, Cam, do you want to give us a little bit of the details on these new restrictions?
Certainly, yeah. It's a shocking escalation, as shocking as anything to come out of the Trump administration in recent weeks and days. But this one, I think, really demonstrates the cruelty and the deviousness of the means that the U.S. is employing. And I'm also really fascinated by this one because we've spoken about this before, that the unilateral U.S. blockade on Cuba is, on the face of it, an attempt to crush the Cuban Revolution and an attempt to effectively recolonize the island on behalf of U.S. interests. But it has really potentially and demonstrably severe effects for the entire world, where Cuba is an exemplary global citizen, in spite of all of the U.S. attempts to isolate Cuba. Cuba's profound internationalism as regards, and this is precisely what they're afraid of, the export of revolution and so on, right? But we should also talk about the export of medicine and literacy and the really, really compelling assistance that Cuba has offered to so many global South countries. The U.S. blockade is an assault on pretty much the entire global South. So I'm getting a little bit ahead of myself, but you'll see why. The U.S., this is last Tuesday, expanded visa restrictions, and I can read from this press statement from Marco Rubio, on the expansion of visa restrictions policy for individuals exploiting Cuban labor. This is so deceiving. Today we announced the expansion of an existing Cuba-related visa restriction policy that targets forced labor linked to the Cuban labor export program. So this applies to Cuban government officials who are involved in labor export, quote, particularly Cuba's overseas medical missions. This policy also applies to the families of such persons. And they've already moved to restrict individuals under this policy, including Cubans and Venezuelans. This is a very peculiar claim, but it has some basis in the anti-Cuban counter-revolutionary rhetoric of recent years in particular, where this visa restriction policy is really intent on demonstrating that Cuba's medical internationalism is some kind of human trafficking program or a forced labor program. It says in Rubio's brief that Cuba continues to profit from the forced labor of its workers, and the regime's abusive and coercive labor practices are well documented. Cuba's labor export programs, which include the medical missions, enrich the Cuban regime, and in the case of Cuba's overseas medical missions, deprive ordinary Cubans of the medical care they desperately need in their home country. The United States is committed to countering forced labor practices around the globe. To do so, we must promote accountability not just for Cuban officials responsible for these policies, but also those complicit in the exploitation and forced labor of Cuban workers. So, I can't read that quote facetiously enough. It feels awful to even put those words in my mouth. But we'll talk today, I think, about all of the many respects in which this is untrue. And I think we'll most importantly arrive, hopefully, at a bit of a discussion as to how this claim that the medical missions deprive ordinary Cubans of medical care and deplete their medical system domestically This is nonsense.
It's quite the opposite. In fact, I mean, because the medical missions that Cuba does around the world has actually improved healthcare at home in Cuba, because you have doctors and nurses and other medical professionals going into these situations that are perhaps more dire than they are in Cuba, into war zones or into natural disaster locations, and their doctors are learning how to perform medicine under these conditions. And like for example, under the special period in the 1990s, when the blockade was on Cuba was perhaps at its most severe, the Cuban doctors benefited immensely from having these experiences in other parts of the world where there were so many deprivations of the proper medical equipment and the proper medical conditions that you would expect to see. So I agree with you. It's sickening to hear, and it is hard to read it out loud as well.
Well, and so many people come to train in medicine in Cuba from around the world, and it is a beacon to the world in terms of medical education and outreach. I think that Cuba's medical internationalism appreciably benefits the people at home, even as it trains up people elsewhere. But think of some of the fundraising that we've done through our respective solidarity campaigns, buying syringes for Cuba, where Cuba has a very remarkable COVID vaccine, but the blockade prevents Cuba from accessing supplies enough to administer it to its own people. It's again a very, very straightforward instance of the blockade depleting the quality of care that Cuba can extend, where it has the personnel, it has more doctors per capita than any other country. It has a really remarkable public insurance system. Everybody has absolutely free health care. It's only the materials that are embargoed. So it's not that Rubio doesn't know this, and his narrative joins a very devious program of aspersion that, last year I read an article about medical servitude in the Harvard International Review or something that, you really shouldn't be reading anyway, but its accusation against Cuba's medical internationalism is that the doctors are hostages overseas. That's its exact language, and that they are practicing a form of monetized altruism, that they are doing ideological export, and that this is intended to enrich the revolution whilst the doctors themselves are forced to labor abroad.
It's so disingenuous. I mean, like, for one thing, the doctors from Cuba who go overseas, they get paid the regular fees that domestic doctors would get, and then they get an extra income on top of that. So the doctors are actually paid quite well. And of course, Cuban doctors are not paid like American doctors are paid or Canadian doctors. It's true. But they also have a much different approach to medicine and a much different calling to a medical career. This idea that Cuba's enriching themselves is also just completely fabricated. Cuba charges the countries that it sends medical personnel to based on their ability to pay. So this means that some countries will pay much less than others. But for example, a country like Qatar, which is an oil-rich country and where Cuba has sent doctors, a country like Qatar will pay more than, a country like Bolivia. Yeah. But this money isn't going into the pockets of members of the Communist Party of Cuba. It's being invested back into medical system, into education, into all these different things. I mean, this idea that there's some sort of enrichment going on is just such a disgusting accusation. And, sometimes the Cubans don't even get paid for the services, right? There's, one of the most amazing examples of Cuban medical internationalism is the amount of support they gave to victims of Chernobyl. and how many victims of Chernobyl came to Cuba for medical care, mostly children. And many of them stayed in Cuba for years before they were able to go back home, finally treated for all the issues they were facing. I mean, it's interesting with what's going on in the world today. And, we just saw that video of Trump berating Zelensky very publicly in front of all these cameras. But it was Yanukovych, who was the president of Ukraine, who was overthrown by the U.S.-backed Maidan coup. He had promised to pay back Cuba for all the medical assistance that Cuba had given to Ukrainians. And then, of course, they overthrow the government, the Yanukovych government, and, no payment has yet to come. But this is just more proof that Cuba's their first thought isn't about the money. The other thing that I think needs to be talked about is how much Cuba's also going out to help in pandemics, like the work they've done on Ebola, on dengue fever, the work they did with COVID. You mentioned the vaccines they came up with, but they were also going to Italy, a so-called first world country, to support their COVID efforts there. So by making it more difficult for these medical brigades to go out across the globe, are we going to start seeing more pandemics becoming less constrained because there is less of this action by doctors like the ones coming from Cuba?
Absolutely. And, this is something that ironically is proceeding alongside, that is the attempt to sanction Cuban medical internationalism is proceeding alongside the U.S. withdrawal from the World Health Organization and things like this. So it almost seems part of a plan to further underdevelop the global South. I don't think that this idea of ideological export and so on is credible in light of the fact that Cuba is typically requested by the UN and by all kinds of partnering nations. Their participation is welcome. We'd spoken before about USAID. I hear one or the other. This is sort of the only constructive capacity, I think, in which Cuba sometimes works alongside U.S. doctors under that program. They are typically welcomed because of the high quality of care and the specific practices for which they are renowned. Cuba has a very strong commitment that penetrates policy to long-term, community-appropriate, culturally appropriate care. They stay, they learn the customs, they come up with culturally appropriate infrastructure. Sometimes that is local, as in, famous cases, Sierra Leone, the Ebola outbreak in 2014, was it? And I just want to briefly say, I thought I was reading about Ebola outbreaks in Uganda last week. History repeats itself because of the terribly uneven standards of care extended to the world and because of imperialist and neo-colonialist underdevelopment and so on. So Cuba remains really the vanguard of this struggle. But these are just a couple of chapters in really remarkable outreach. You were talking about Chernobyl. They established a pediatric hospital outside of Havana that runs to this day specifically to deal with endocrine problems and thyroid cancers and the leukemias and so on, the long-term outcomes of acute radiation poisoning, whatever you would call it. Like it's remarkable, the duration of the care that they extend. I can't think of any comparable service that any advanced capitalist country has extended to the international community. And again, where Cuba's participation alongside the doctors of those countries is concerned, it wouldn't matter if I could, really. Like they're the gold standard in a fairly politically disinterested sense as well, and acknowledged as such by the international community. Rubio would have to explain why Cuba's medical programs abroad are importantly different from Doctors Without Borders.
Yeah. And it's fun. It's interesting because Cuba has more doctors across the world than Doctors Without Borders. Also has more doctors across the world than all of the G8 countries combined. And they're sending doctors to places that really don't have doctors. Like I think the first sort of medical brigade they sent was to Algeria after the revolution, and all these doctors were leaving, right?
Yeah, 1963.
Yeah. And so Cuba, sends doctors to where there are no other doctors. And, we've sort of mentioned this, but just to be clear, like they go and they embed themselves with the community. So like, whereas U.S. doctors often go to places for disaster relief, they end up staying in like swanky, rich hotels, whereas the Cuban doctors stay in the communities that they're serving. And it's not just, it's a solidarity thing, but it's also because they have a community perspective on health. So they want to know what are the living conditions of the people they're treating, because they have like a holistic approach to it. And the reason they stay longer, and they stay longer than like doctors from other countries, especially, from the US, but they stay longer because, we have sort of mentioned it, but they're training doctors there. So they're setting up medical facilities so that when they do leave, that country is set up with their own, their own ability, their own capacity for continued medical care. It's really quite amazing what they're doing.
Yeah, and that durable long-term infrastructure and the knowledge exchanges that constitute these programs, very important, but also the long-term attendance of Cuban doctors. This is, again, all very disingenuous, but this is part of what supports this forced labor narrative, because it's typical that over the course of someone's education, they might spend 2 years abroad.
Yeah.
And what I would recommend to people is there's a book called Exporting Revolution by Margaret Randall. Margaret Randall is a literary translator who lived in Cuba for some time, and she's also translated a wonderful collection of classic and contemporary Cuban poetry and so on. But in the course of this book on Cuba's international reputation, she translates, and I found this fascinating, and I wish that they were in publication as complete memoirs, but she translates interviews and short fiction by Cuban teachers and doctors describing their time abroad, and with pride, with pride in the revolution, and with a spirit of international camaraderie that is just absolutely foreign to the understanding of, a Marco Rubio, perhaps to the American understanding. Nobody is coerced to go abroad. This is something that you actually need to develop, I want to say, a cultural sensitivity to. You read these memoirs of doctors who the most coercion that they describe in coming to the decision to go abroad is a powerful calling, is the feeling that they are being called by the revolution to a task that is larger than themselves. And this might mean leaving a young family. It might mean putting your life at home on pause. It absolutely means sacrifice. And these are just values that are exemplary. So I think that we also could even stop and on a sort of like moral ideological plane say that this is again a remarkable characteristic of the post-revolutionary Cuban spirit and social contract, which extends far beyond Cuba itself. I don't think that there's anything to disparage there. And it's very, very miserly that someone should try to re-narrate this spirit as coerced. I think that another really distressing aspect of this, you were speaking about the beginnings of Cuba's medical internationalism circa Algerian independence, where Cuba was supplementing brain drain and an enormous exodus of, shall we say, bourgeois specialists, because there is this period where this happens in the Cuban Revolution as well, and it's a problem. We're speaking about the present day escalations against Cuban doctors, but for a long time, the main U.S. initiative to disrupt Cuban medical internationalism, it was like a stated program, the Cuban Medical Professional Parole Program, which was a targeted attempt upon the regions where Cuban doctors were serving to lure defection. So the U.S. would actually try to poach Cuban doctors out of disaster zones and stricken areas of the world and try to entice them with higher rates of pay and so on. So not only has the United States been disparaging Cuban doctors as if they were trafficked, the U.S. has actually been meddling in the health of other nations by going and trying to steal Cuban doctors off the ground. And this was an official policy, the medical professional parole policy.
Yeah, and when you compare that to, it's also the blockade that's causing a lot of brain drain from Cuba, right? Because the blockade creates such conditions in Cuba where some people are forced to migrate to escape those conditions that are caused by the blockade. But you look at how Cuba challenges brain drain by, for example, setting up its Latin American School of Medicine, where they bring in people from all over the world, but mostly, third world or, poor countries. They completely pay for all the medical education. The only thing that international students have to pay for is their transportation there. The Cuban government pays for the classes, textbooks, they pay for dorm rooms, they pay for all the meals, medical services, they get equipment like stethoscopes and whatever else doctors need. They get rations like, toilet paper and soap and all that kind of personal stuff you need. And on top of that, they get a stipend. So like spending money. The way they select students is they select students based on their commitment to social justice, right? And so they are bringing working class people who couldn't study medicine otherwise into Cuba to become nurses, doctors, other medical professionals. And then the only deal is that they have to go back to the communities they're from to serve those communities, to bring medical care to those communities. Like I think in the most recent statistics I could find, there's 110 countries represented at the Latin American School of Medicine. We've talked about it quite a bit already, but it's like when they are going to these places to bring medical care to the people of the world, they're also, sustaining that medical care through training medical professionals to go back there and support those people. And, part of the education too is they also take into account where the doctors are coming from. And part of that education is traditional medicine. They're also teaching culturally appropriate forms of medicine to people. And one thing that's funny is because they do have people from Canada and people from the United States. And one thing that's funny I read is that these students also have to go through classes of why their countries are imperialist, which is amazing. I appreciate that quite a bit. But yeah, this Latin American School of Medicine, it was they established it in 1999, and it was a reaction to what Cuban medical personnel witnessed during the emergency brigades in Central America following Hurricane Mitch. They saw the need, the amount of need that was out there for local medical care, and this is how they responded. From this school, half of the people who graduate are women. So many of them are indigenous peoples. It's really an incredible program that they've started.
Yeah, and just like the Cuban medical aid to Africa also involved the reincorporation of local and indigenous practices and customs that had been all but suppressed by European colonialism. This Latin American school of medicine, it's a calling card of Cuban internationalism, but it extends so far beyond that. We know in Latin America and the Caribbean and really all over the world that Cuba has developed this remarkable network. And we know about its attendance of really acute emergencies, earthquakes, and so on. There's another aspect of this where people in North America have been solicitous of this training and expertise and specifically denied it. The most famous example in the United States would probably have been during Hurricane Katrina, where Cuban medical aid was turned away by the government. This was a large offer. More than 1,000 doctors were willing to come to New Orleans. One of the most ghoulish things that I've seen in terms of the Canadian state running interference on Indigenous sovereignty and the ability of First Nations in Canada to have their own nation-to-nation agreements was in the early days of the COVID pandemic. People were badly assailed. We've spoken about Cuba's assistance to Italy, and I think that we can all remember how horrifying the scenes out of Italy were. But in Manitoba, where I'm sitting, there was an episode where the Southern Chiefs organization asked the federal government to allow Cuban doctors to attend to the nations that they represent in Manitoba. 34 different communities that were assailed by COVID under really frightening conditions, and they wanted Cuban doctors. They wanted Cuban doctors to shore up shortfalls, the obvious shortfalls owing to underdevelopment and colonial ravages, to come and support their communities. And Cuban doctors were willing, and there was even I think there was a delegation to Havana with First Nations leaders from Manitoba and Alberta. And this really interesting sort of interchange was being proposed where Cuba would also train Indigenous doctors from Canada. The federal government shut it down. Chrystia Freeland, in my opinion, one of the great villains of Canada's present government, was adamant that Canada's healthcare system has more than enough capacity to deal with this and wouldn't permit Cuban doctors access to those communities. I don't know how her refusal to grant those visas to the Cuban doctors interacts with the various coercions of the U.S. blockade. But I do know that at precisely the same time that the Canadian government was preventing Cuban doctors from reaching First Nations in Manitoba, they were sending body bags instead of medical professionals. So much of our self-opinion over against the United States and their deplorable healthcare system has to do with our putatively universal healthcare. How does that interact with the apartheid conditions facing so many First Nations? Mm-hmm. Canada, with its, similarly renowned healthcare system, left people to die rather than permit them to make this nation-to-nation agreement with Cuba. It's one of the most ghoulish episodes in the last decade of liberal governance in Canada, I think. I couldn't believe it.
And, we had to put it in context, too. Like, there was twice as many deaths from COVID per capita in Canada than there were in Cuba. Cuba and Canada have very similar health care indicators, like, fairly similar life expectancy. I think Cuba is 78. In Canada, it's 81. In the U.S., it's I think it's around 76 or 77. But when you take into account the apartheid system, as you were saying, like for Indigenous people, life expectancy is 73 in Canada, and it varies widely from group. I saw something that said that in Alberta, Indigenous people in Alberta have a life expectancy of 63 years. It's quite harrowing, but it's also very in line with Canadian history.
Yeah, absolutely. And again, where our boastfulness is concerned, the numbers don't lie. I think that Cuba has 8.2 doctors for every 1,000 people, and Canada has 2.6. We are just far more insecure by a terribly material standard than Cuba, where health is concerned.
And if you actually look at how healthcare is dealt with in Cuba versus Canada, it really is night and day. Like, we are lucky to have a one-payer system in Canada, but at the same time, our medical system, our healthcare system, is being chipped away at. There are private clinics that are popping up that are creating a two-tier medical system. This is totally against the Canadian Health Act, but when Trudeau was asked about it, he said it was innovative. And you talk about those like 2 doctors per 1,000 people versus 8 versus 1,000 in Cuba. The way they carry it out too is it's much more. The healthcare is much more integrated into the communities that people live in. So like before the revolution, medical care was extremely rare in rural areas. It was, a very racist system. There was like no black doctors, no women doctors really. But after the revolution, their first goal was to bring medical care to rural areas, to racialized peoples and other communities that were oppressed and didn't have the same access to healthcare. And over 2 or 3 decades, they experimented with their system to come to the general model that they have today. It's an ongoing process. I think what's interesting about their healthcare system is they're constantly reevaluating it and constantly changing it to the changing conditions. It really is part of the ongoing revolution. But when, similar to Algeria, when Cuba had the revolution, about half the doctors fled to the United States. And so they really put an emphasis on training more doctors and training more nurses. And like I said, like, Cubans have a much different approach to healthcare. They have like a holistic, social, like biosocial view towards medicine. It's focused on prevention, not on curing people. So it prevents illnesses by addressing the social conditions which cause or exacerbate illnesses. This is the system they call the MGI system, the Medicina General Integral. That probably sounded more French than Spanish. I apologize. But in English, it's the Comprehensive General Medicine system. And so like every single neighborhood in Cuba has a doctor's office, and each doctor's office has a doctor and a nurse team that's responsible for everybody in that neighborhood. And this is like neighborhoods about a 2 to 3 square block area, and it's a total of about 120 to 150 people that this doctor and nurse team look after. And the doctor and nurse team, they live in the neighborhood, right? So they often live in the clinic, like it's a housing facility as well. Yeah, exactly. They have like the clinic on the first floor, and then the second and third floor are housing for the doctor and nurse. And so it's like your doctor is your neighbor, and the doctor and nurse teams, they make regular home visits. There's actually a minimum number of home visits that have to be made annually, but oftentimes doctors and nurses are exceeding that minimum, but they're going to your home to like check on the conditions that you're living in. And they have something called the continuous assessment and risk evaluation, which determines how many times that the minimum time the doctors need to come visit you annually. But like, the doctors and nurses, they just walk over, right? It's like they're not driving their cyber trucks from their mansion in the suburbs to come into the clinic to, like when you go to the doctor's office here, it's like you can only talk about 2 things. If you have a third thing, you need to come back for another appointment, right? It's like they come and they talk to you, and then it's like a really like integrative approach, because, I was reading this one example of this woman who was getting sick from methane in some homemade rum that she had been creating, and the doctor and nurse team went to their home, and they saw that there was like issues in the home with the home needed some repairs. The toilet wasn't correctly hooked up to the sewer system. They weren't getting rid of their garbage correctly. So the doctor and nurse, were teaching them about different things they could change in their lifestyle to increase their health. But they also would go out to like the Communities in Defense of the Revolution, which, are these community groups that can help you with fixing up your house, making sure the toilet is connected to the sewer, making sure that your garbage pickup is done properly. They really do have, an overview of the whole picture to create a preventative system. And this is also, I think, why they're able to deliver such high quality of care despite the blockade. Because although they may not be able to have the same access to like fancy medical equipment that they do in Canada or the United States, and they don't always have access to the parts they need to repair or to maintain those machines because of the blockade, but because they take such a preventative approach, they don't need those machines as much. It's amazing how, when you read about how this idea of like the doctors and nurse teams being so integrated into the community, that your neighbor, when they come in and they sit down with you, it's not like there's no like power imbalance there like there is here. I read this one thing about how during different times in Cuban history, because of the blockade, there are some sort of like illegal activities that some families do, like out of their house, just to like make some extra money. But everybody is clear, including the doctors, the nurses, and the people, that the doctors and nurses aren't coming in to surveil them. They're not coming in to like snitch on them. They're coming there just for health. And so the people like trust the doctors. They let them come in. Mm-hmm. And so in addition to these community clinics and these community doctor and nurse teams, then they have the polyclinics. And each polyclinic basically manages around 30 of these neighborhood clinics, and that's where you might see a specialist. That's where you might be sent to see like a psychologist or OBGYN or pediatrician or physical therapist, nutritionist, social worker, etc. Their healthcare is so like extensive, and so obviously I would rather have this sort of medical system in Canada. And like I said earlier, it's so much cheaper, and like it's cheaper because it's preventative, and there are some other reasons. There are some comforts that we're used to in Canada that they don't have in Cuba, which also makes it cheaper. Like if you go to, if you have a hospital stay in Cuba, for example, there's probably not going to be a TV in your room, like that kind of stuff. But like, they're focusing on what's actually important, people's health.
Absolutely, and the family doctor model in Cuba, to make sure that everybody has a very personalized standard of long-term, more attentive care in community. We should compare this family doctor system to Canada, where last I read, 6.5 million Canadians don't have a family doctor and can't find one. This is only getting worse, and we need to be terribly, terribly honest about not only the profound successes of Cuba, but also the comparative shortfalls in capitalist healthcare. I think that we could learn an awful lot from
100%.
Cuba. And it's incumbent upon us, I think, to almost demand that we forge those relationships and seek out those precedents rather than follow the U.S. path.
Well, yeah, I mean, it's interesting. Cuba spends around $500 per person a year on healthcare. I mean, the U.S. pays around $9,000 per person, and so much of that cost actually has to do with their like insurance systems and all the bureaucracy they need and all the paperwork they need to be doing. That's significantly less in Canada, but Canada's still paying around $4,000 to $5,000 per year for healthcare, and I think it's pretty reasonable to say that we're getting worse healthcare in Canada. Like I have a friend here who had this, cough for a long time. It wasn't going away, so he said, "Okay, I got to go get some medication." He tried to get an appointment with his GP. It was going to take 2 weeks. So instead he's like, I'll just go to the clinic. You have to get to the walking clinic by 7 in the morning or you're not going to get in that day. There's stories I'm in Vancouver where I think it's particularly bad right now. And you see stories of people who are dying from cancer waiting to see a specialist. It's horrifying. And we know it's only going to get worse. Another thing about the Cuban system is that because it is all publicly owned, it is all state run, they're able to address people's needs. During the COVID pandemic, when, all over the capitalist world, they were running short of personal protective equipment, like masks and whatever.
Yep.
Cuba was just able to transition immediately their factories that were making uniforms to making PPE. And then you look at how they were able to come up with some vaccines for COVID so quickly. They were able to come up with 5, and I think 2 ended up being ones they were using. But because they have that publicly owned pharmaceutical industry, and they've also come up with amazing medications. They have a vaccine against Haemophilus influenza type B. They have a vaccine for lung cancer. They have a treatment for diabetic foot ulcers. They have an amazing pharmaceutical publicly owned industry.
One of the really interesting panels at that World Balance Conference that I was aware of concerned the impact of the blockade on biotech and IP and things like this. But the case study was in a Cuban treatment for Alzheimer's, which has a really remarkable success rate at stabilizing cognitive function in people suffering from Alzheimer's, and could be a game changer on a planetary scale. So again, I really think that it's our responsibility too to underscore the respects in which blockading Cuba, where Cuba is a properly internationalist society, is potentially depriving Canadians of life-saving treatments.
It absolutely is. And I also think these attacks on the international medical brigades from Cuba are going to have other wider ranging effects on healthcare in capitalist world, including Canada, because, they're demonizing the healthcare system in Cuba to the point where they want to stop people from looking at it as the model that it should be. We should be looking at the Cuban medical system for Canada. We should not be looking at the United States system, which is unfortunately the way we're going. We saw Pierre Poilievre meeting with U.S. medical insurance CEOs, and it's not just the conservatives either, right? It was Justin Trudeau who said that the private clinics that are popping up are innovative. So we are really on the precipice of having a much worse healthcare system in Canada, something that we pride ourselves on, but we can only really pride ourselves on it because we're next to the United States. And if they're going to try to shut out Cuba as that model, what's going to happen to us here? It's frightening.
Absolutely. There's the practical respects in which Cuba doctors to the world, but that which is not reducible to a kind of charity, much less to a racket, as the U.S. would like to portray it. That's only one aspect. There's also the inspiration and the practical model that it furnishes the world, and really the spirit in which it is undertaken. There's that remarkable text, because we should remember that Che Guevara was a doctor on revolutionary medicine. Rubio wouldn't like this. The Harvard wonks wouldn't like this, because he's very clear that the doctoring to the world, this form of extreme solidarity he talks about, should function in peacetime as militias might in a war, and he calls it a new weapon of solidarity. And they would, of course, bristle at this language, but he says in the end, the best way of telling is doing. And I think about that a lot because Cuba is telling us something.
Maybe we can close it with the famous Fidel quote. The U.S. sends bombs, Cuba sends doctors.
El día primero aquel, lleno de emoción y ruido, alguien dijo conmovido y feliz, gracias Fidel. Y el pueblo después de un año repite.